In this video, I want to show you something simple but often overlooked. Healthcare doesn't actually start in hospitals or clinics. It starts where you live. Your zip code, your support system, your education, your access to food, transportation, community resources, and health insurance plan. All of these factors shape the kind of care you receive long before you ever walk into a hospital. Let's zoom out. We all live in the same big world, Earth, but each of us lives in our own smaller world within it. So let's imagine two people, person A and person B. Person A lives in a world with strong social determinants of health. They have stable housing, access to food, transportation, education, and a reliable support system. Person B lives in a very different world, poor social determinants of health, fewer resources, less support, more barriers. Because of that difference alone, their healthcare journeys look nothing alike. When person A goes to the hospital, it's usually for something acute, a short-term issue. Their overall use of healthcare services is relatively low. Person B, on the other hand, often depends on the healthcare system to survive. They live with a chronic or long-lasting condition, which means frequent visits, more medications, and higher utilization of care. Now let's look at the healthcare system itself. Hospitals for inpatient care, clinics for outpatient care, pharmacies, supply chains, labs, research, clinical trials, drug discovery, the list goes on and on. Because of how massive this industry is, it's incredibly fragmented. When person B is admitted to a hospital, their medical records live in one electronic health record system. If they are transferred to another facility, that information may or may not follow them seamlessly, depending on whether the next provider uses the same system. That's how care gaps form. Doctors don't always have visibility into a patient's use of social or community services, and those gaps grow even wider once care happens outside of clinical settings, which is where most care actually happens. Primary care providers tend to coordinate care, make referrals, and provide continuity, especially for patients like person B with chronic conditions. CMS even rewards this type of ongoing management, but the primary care workforce is aging. Many clinicians are burned out due to constant changes, and there is a workforce shortage in healthcare. Meanwhile, administrators and policymakers rely on high-level data from millions of patients like A and B to make decisions and allocate resources. Unfortunately, that data often misses the reality on the ground because the truth is care is dependent on who you are and where you come from, often before you ever get sick or enter the system. Today, healthcare is largely reactive, not proactive. Many people avoid healthcare altogether. They fear the cost, and frankly, many have had poor experiences in the past. That's part of why consumer health app adoption remains low. Healthcare technology hasn't moved fast enough, and the experiences people associate with healthcare are outdated and frustrating. If we want adoption to improve, providers need to actively promote consumer apps, and those apps need to deliver genuinely good experiences. The media should be promoting a healthy lifestyle just as aggressively, if not more so, than medications. So, after looking at all of this, here is where I land. If we really want to fix healthcare, we need to fix people and help them live better, not just treat disease. Tools that help improve morale, that encourage gratitude and positive action, that support exercise, medication adherence, and access to healthy food, that help people stay hygienic, navigate childhood trauma, and become better parents. Tools that increase transparency, rebuild trust, encourage giving back, and yes, force us to reconnect in person. This is where investors, builders, and billionaires should be placing their bets. Healthcare apps shouldn't remind people that they are weak. They should remind people that they are proactive, capable, and committed to managing their health every single day. Thanks so much for watching this video. Happy holidays and Happy New Year 2026.